Okay, so one of the things that I wanted to briefly go over, some of these topics, these are awesome topics. So some of you are going to be discussing fibrous joints, cartilaginous joints, and synovial joints. So different types of joints, their structures are different, their functions are different, the joints are different. So besides muscles, right? Yeah, muscles cross bones, and they cross bones at joints, and they move differently. So some of you are going to look at fibrous joints, cartilaginous joints, and synovial joints. Some of you will talk about stability versus range of motion. I have, if you're on Nutrition Chirodoc, I have some older videos that I've done where I actually demonstrate all the different ranges of motion. Some muscles create great range of motion, and some are designed for stability, right? If we look at the rotator cuff muscles, some of them are stabilizers, and some of them do great mobility. You can talk about where bones come together and they create joints. We have burses and ligaments. Some of you may decide to talk about bursitis, subacromial bursitis, subdeltoid bursitis, ischial bursitis, trochanteric bursitis. So there's so many different places you can go and comment with these. Some of you may decide to take it into kinesiology, where you talk about different levers, a first degree, second degree, and third type lever, where you have the force on one side, the axis on one side, and the resistance on the other. The force, axis, and resistance, depending on where they're located with muscles, can create different types of lever, type 1, 2, and 3. Agonists, antagonists, and synergists. Um, muscles can be synergistic to one another, meaning they work in harmony, like the biceps and the brachioradialis work in synergy. But if we talk about the biceps and triceps, they're antagonistic to one another. An agonist is your primary mover, so you will be discussing all of those. The big difference between skeletal muscle, smooth muscle, and cardiac muscle, knowing what those differences are is key. We did discuss the four muscles of mastication, so that's kind of cool for someone that wants to take that: origin, insertion, and action. You have to be really clear because the jaw can retract and it can protract and it can adduct and abduct. So you have to be able to describe what those are. The temporomandibular joint, the bones that form it. We did mention TMJ dysfunction. The shoulder joint, right? The glenohumeral joint. What are the bones that make it up? What are the ranges of motion? That means the different ways that the shoulder can move. It can flex, it can extend, it can internally and externally rotate, it can abduct, adduct, it can horizontally adduct and abduct. And you could talk about some of the common dysfunctions of the shoulder. Is it a frozen shoulder? Is it a shoulder bursitis? Is it a dislocated shoulder? There's so many different places to go with that. Same thing with the elbow. The elbow is, well, as the shoulder is a ball and socket joint, the elbow tends to be a hinge joint, but a modified hinge joint, because hinges can flex and extend. But remember, the elbow can supinate and pronate, so there's a rotational component to it. In terms of common dysfunctions, maybe some of the ones you'll want to talk about are golfer's elbow and tennis elbow, which is medial epicondylitis and lateral epicondylitis. Pronator Terry syndrome, that's another biggie. The hip joint, that glenohumeral joint, what are some of the bones that make it up? Ranges of motion are key to be able to describe it. You may want to use pictures and stuff to demonstrate. That's fair game. Common dysfunction, maybe hip arthritis, degeneration, people that go for hip resurfacing, like yours truly right here. A few years ago, I had to go through a hip resurfacing on one of them. People go for hip replacements. What is that involved? The knee joint, what are the bones that make up the knee, and it ranges its range of motion? What are the common dysfunctions? You may want to talk about the terrible triad, the meniscal tears, Valgus and varus, deformity of the knee, right? Knock-kneed and bow-leggedness. So someone may want to discuss that. The ankle, dorsiflexion, plantar flexion, inversion, eversion, common dysfunctions. There's tarsal tunnel syndrome. That's pretty big in terms of the ankle and foot. There may be some overlap. There's pes cavus, pes planus, right? Flat feet, high arches. There's plantar fasciitis of the foot. There's bunions. There's hammer toes. There's gout affecting the great toe. The foot, the special movements, there are some extrinsic and intrinsic muscles of the foot. The vertebral joints, you would want to pay some special attention to the atlantoaxial joint. That's the atlantoaxial, C1, C2, and then the axial occipital. That could be between, let me see if this looks like there's a mistake here. This should be the atlantoaxial, and this should be the atlanto-occipital. Yeah, atlanto-occipital and atlanto-axial. The intervertebral joint anatomy, these are between any two vertebrae. Winged scapula, you heard me mention the importance of the serratus anterior. Muscles of the back, they're superficial to deep layers. How are they organized? Muscles of breathing. What are the muscles of the thorax, the abdomen? What is the importance of the diaphragm and rib muscles? There are these intercostal muscles, the internal and external intercostal muscles that are involved with breathing. There are also scalene muscles, which are cervical muscles that attach to the top of the ribs. They're called the scalene sisters, scalenus anticus, medius, and posticus. Why do I have to do so many sit-ups? Oh, that's a good one. Muscles of the rotator cuff. Cool. Break it down, the injuries. Shoulder is very, very commonly injured. You could talk about which is the most commonly injured rotator cuff muscle, how they happen. What is carpal tunnel syndrome? Talk about the normal anatomy. What muscles can degenerate and break down as a result. Muscles of the hips and the thigh. So you want to break them down into compartments. What is the anterior compartment of the hip, the posterior compartment of the hip, the medial compartment, lateral compartment? That's how you want to study them, by compartments. Kick me. So what are the muscles of the leg? What are the anterior leg muscles, which are dorsiflexors? What are the anterior thigh muscles? What are the posterior thigh muscles? What are the posterior leg muscles? Which ones extend the knee? Which ones flex the knee? Which ones dorsiflex the foot? Which ones plantar flex the foot? You heard me talk about the sarcomere. This is the functional unit of muscle. I think I have a video on that as well, talking about actin and myosin and troponin and tropomyosin and acetylcholine and calcium and the sarcoplasmic reticulum and the synaptic cleft. These are all really important terms. Transverse tubules. These are all things you're going to hear. Types of proteins, the thick and thin ones. You heard me mention actin and myosin. You'll talk about the protein filaments and the power stroke that takes place. Calcium's involvement in muscle contraction. Here's the NMJ, the neuromuscular junction that I mentioned earlier. A lot of these are going to be overlap, so you're going to have some great dialogue amongst each other. The tone of muscles, maybe you'll talk about hypotonia, hypertonicity, muscle spasms, things like that. Posture and stability, the force of contraction. What are the different aspects of gaining strength versus fine motor control? The all or none principle is about nerve impulses going to muscle. The sodium and potassium with nerve impulse. So you're going to learn about depolarization and action potential. I also have this in some of my videos, the types of contraction. There's concentric, eccentric, isometric. This is really cool. The red versus white fibers, also known as fast and slow twitch fibers. These help you understand which has better blood supply. They're red fibers. White fibers have poorer blood supply. Some of them have more mitochondria, less mitochondria, which helps to explain why some are used for power and strength but fatigue easily, whereas some are used for longer distance, like marathon runners. So you want to compare the difference. It also helps you understand why at Thanksgiving time, why you have meat, and maybe some prefer the dark meat, some prefer the white meat. It's all about red versus white fibers. Men versus women in muscle mass. What does the research say about that? Feel the burn. This is really cool. I hope someone does take these. This is about when you exercise. What does that burn? How does it relate to lactic acid? Does it relate to lactic acid? Is there a new way of thinking about the burn? Okay. Arnold versus the Blade Runner. That's kind of cool, right? Bulking up with weights versus running. Connect the dots, ATP and mitochondria and muscle. There's so many different ways you can go with this. When you exercise and train, you do increase what's called mitochondrial biogenesis. The more muscle mass you put on, the more mitochondria, the more ability to burn fat for fuel. Pretty cool. So maybe you can get into body composition with that. And then comparing strains versus strains. Strains with a T involve muscles and tendons, and sprains involve ligaments. Okay, so that's a little bit of a breakdown, lowdown, and to help you kind of figure out your way and navigate through that. Let me stop the recording here once again.